Welcome to Wellness and Wisdom with me, Dr. Nadu Tuakli. Here you can expect to hear conversations about everything women over 40 care about, from optimal wellness and peak performance, from intimacy to travel and finances and more. I will be speaking to interesting women and sometimes men to educate and motivate you to live your best life. If you want to find out more, please head over to my website, drtuakli.com, or subscribe to my blog. You can also read my book, Sex, Sanity, and Sleep. We are in this together. Welcome to today's episode of Wellness and Wisdom, where we're diving into one of the most transformative and misunderstood phases of a woman's life, menopause. Over 1 billion women globally will be experiencing menopause by 2025. Here in the US, around 6,000 women a day reach menopause. And by 2030, it's estimated that 1.2 billion women worldwide will be postmenopausal. That's a massive part of the population, navigating the physical, emotional, and societal challenges of this stage. And yet it remains a topic that is shrouded in silence and stigma. Despite menopause being a universal experience, more than 2/3 of women feel unprepared for its onset. Symptoms like hot flashes, night sweats, insomnia, mood changes, brain fog can disrupt every aspect of life. Research shows that 75% of women never discuss their symptoms with a healthcare provider. This podcast isn't just about understanding the changes your body is going through. It's about empowering you with knowledge, breaking taboos, and celebrating this new chapter of life. Menopause is a deficiency state in which the ovaries mainly stop producing three main hormones: progesterone, testosterone, and estrogen. And these are major steroid hormones. Steroid hormones are derivatives of cholesterol. Who knew? There is a receptor for these hormones in every cell in your body. This is why the effects of the body are so wide reaching, and they don't just affect the pelvic organs, they affect all your organs. With such wide-reaching effects, it's no wonder that understanding menopause can feel overwhelming. That's why I'm thrilled to have Dr. Barbie Taylor joining us today.
Thank you.
Her clear, relatable, and evidence-based approach, she's been a guiding light for countless women navigating this major life stage. Dr. Taylor, widely known as Menopause Barbie or Menopause Taylor, is a retired gynecologist from Texas who has dedicated herself to educating women about menopause through her popular YouTube videos. Her channel covers a broad range of menopause-related topics, from understanding symptoms to managing them naturally or with hormone therapy. Dr. Taylor is known for her clear, no-nonsense approach, making complex medical information more accessible to women seeking guidance on menopause and overall health during midlife. She often incorporates humor and relatable examples, helping her audience feel more informed and empowered in their healthcare decisions. So today, we're going to have an engaging discussion about menopause. Whether you're curious, overwhelmed, or just ready for clarity, stick around because we're here to make menopause a topic to be embraced, not avoided. So let's get started. Nice to see you again, Barbara.
Thank you.
Welcome back.
I'm happy to be here. Thank you.
So I know your time is tight, but can we start by defining 3 key terms: perimenopause, menopause, and postmenopause? In my book, I call it Meet the Pauses.
Meet the pauses. Well, actually, there are 3 hormone phases to every woman's life. There's pre-menopause. Pre means before. Pre is all your reproductive years from puberty until your very last period. That's pre. Peri is all the time surrounding your last period. So it's a period of time before that last period, all the way to about 2 years after the last period. And that's what everyone calls menopause. So perimenopause is the actual time for the transition. So think about puberty. Puberty is this, 3 to 5 year time frame during which you are transitioning. Before puberty, you had no signs of adolescence at all. After puberty, you're finished with it. Okay, so perimenopause is that transition time. And this is the part that gets everybody's attention, but they don't realize that there's more to it than that. So everyone focuses on this transitional state. After that, when you finish all the transitioning, you're going to live the rest of your life as a postmenopausal woman. So here's my Plato graph of all this. Here's premenopause. This is during your reproductive years where you have period after period after period after period, and you never have a clue that anything's ever going to change. And then you go through perimenopause, which is a 2 to 10 year period of time when your estrogen and progesterone both are gone. And you're going to live the rest of your life in postmenopause. Now, nobody knows when this will start. Nobody knows when it will end. And nobody knows where you are in the process. And you shouldn't care at all. Any more than you had to know the day you started puberty or the day you finished. You shouldn't worry about those details. What you should know is that the goal is to know that you're going to live the rest of your life in a hormone deficient state unless you do something to bridge this gap and continue giving your body the estrogen it wants. And estrogen is the hormone of interest. Estrogen is the hormone of menopause. Progesterone is only a piggyback. You see, I teach about the 3 hormones by using Goldilocks and the 3 bears. Because these hormones are just like the bed, chair, and porridge of the 3 bears. Each bear had his own bed, own chair, own porridge. Okay, so estrogen belongs to mama bear. Estrogen is what makes mama bear mama bear. Everything about your life is about this. And if you don't get your estrogen right, nothing will be right. Period. End of statement. You focus on estrogen. The goal is to make sure you have enough estrogen and all your decisions are governed by estrogen. The only reason mama bear produces progesterone is to protect baby bear in utero. Pro means in support of, gest means gestation, which is pregnancy, and own means hormone. Progesterone is the hormone in support of pregnancy, and the only reason mama bear produces it is for baby bear. So the one big mistake I see women make all the time is they focus on progesterone instead of estrogen. Now that's like trying to wear baby bear's clothes. Okay, you will never, ever, ever succeed if you don't focus on your own hormone. Okay, and then we have papa bear. And testosterone is to papa bear what estrogen is to mama bear. So men, everything about a man is all about his testosterone. Again, I see women worrying about testosterone before they ever get their estrogen right. And the bottom line is, first things first. If you don't get your estrogen right first, nothing else will ever be right. But when you get these basic facts and you realize that the identities of these hormones differ in terms of to whom they belong, it's easy to get it right. But when you're hearing all these different things from different people and using the wrong hormone for the wrong reasons, there's no way you can get it right.
So what exactly is menopause? When does it start?
Well, you grow into it. It literally starts when you run out of estrogen. That's postmenopause. You've run out. You've gone through all of this transition and you're there at the land of 0 hormones for the rest of your life. So this is postmenopause. Right. Okay. But this time is not as attention getting for some women as this time. So most people, when they talk about getting through it, they're talking about that. Right. And that's fine and good. But the problem is, this is when you're at risk for the diseases that are due to estrogen deficiency. There's symptoms of estrogen deficiency, and there are diseases of estrogen deficiency. This is just like saying there are symptoms of insulin deficiency at diabetes, and there are diseases of insulin deficiency with diabetes. Which one's more important? The diseases. Okay, but with everyone focusing only on symptoms, they lose the fact that, oh, when you run out of estrogen, you begin having the risk for the 3 diseases of estrogen deficiency, which are heart attack, because estrogen kept your heart arteries clear, and estrogen deficiency puts you on the road to clogging arteries. Osteoporosis, because if you lose your estrogen, you're also going to lose bone. And Alzheimer's, which is where your brain goes from this to this. So it's brain shrinkage. Okay, so you have to think about these big long-term things if you want to get it right. And if you only think about the hot flashes or any of the symptoms of menopause, and there are 22 of them, not just one, most women waste 10 years wondering what's going on. And by the time they wake up to the fact that, oh, they only have one problem, not 22, they're already on the road to the diseases. And then they're like, okay, now what do I do? And it's like, it's much easier to prevent a disease than it is to reverse a disease. And that's why I teach what I do, because if you're not aware of what's going on and if you don't plan ahead, it's going to catch you off guard.
The average age of menopause is 52. And I like the fact that you've pointed out that you don't really get through menopause. It's not something that ends.
Exactly.
It's a process. So
Exactly.
you arrive and it continues. A lot of women say, oh, I should be over menopause by now. I haven't had a period for 2 years.
No,
there's no getting through it or ending it.
Yeah.
And some women can have hot flashes into their 70s. So sitting around waiting for symptoms to disappear is a waste of your time and energy and your health.
Yeah, and you can have these symptoms for the rest of your life and be at risk for the diseases for the rest of your life. I mean, it's very simple. You're not going to go backward. But here's the other thing. I hate when people focus on average ages for anything. The truth is, menopause can happen at any time. And the problem is that when women know of an average age and doctors know of an average age, the 35-year-old woman who is prematurely
menopausal
or postmenopausal, she walks into the doctor's office and they go, no, you're too young. Well, that's insane. Your body doesn't follow a textbook. Menopause can happen at any time. And so I don't like it when people think, well, I'm too young. Every woman who gets my education says two things to me. Number one, she says, I wish I had gotten this education ages ago. And they all say, now that I have the education, I realize that I actually started going through this in my late 30s or what. They all say that. And I'm like, and if only you'd had this education early in your life, you would have recognized it from the start. And they all say exactly. And this is the problem. They don't get this education until they've waited
very late.
Yeah, they're miserable. They're already on the door to disease. And everyone's telling them, oh, you're too young, or, oh, no, that's nothing. And the problem is, if every woman got this education at age 20 or in their 20s, it would be heaven. I mean,
they would be able to prepare for it.
That's my dream. My dream is for all women to get my education in their 20s free on YouTube so that they know exactly what to look for and recognize it from the start, and they can bridge all the gaps and manage it any way they want, but they'll know what they're doing. And that is not the current state of affairs.
True. In fact, once again, people don't talk about menopause at all. It's stigmatized. For some reason, it seems like such a taboo topic. But I like your point about long-term health considerations. Brain, heart, and bone.
Exactly.
There is not enough emphasis put in early life on prevention for those issues. It's not when you start to forget things that you start to realize that Alzheimer's is affected by your estrogen status. But we have to keep working at giving people this information. That, in my opinion, is why it's crucial for women to be proactive about their menopause education. Do you have anything else to add about that?
Well, I think the key is to understand that women tend to focus on the wrong things. You know, we live in a time where everyone's worried about breast cancer. Here are the statistics. 1 out of every 3 women will have a heart attack, and 1 out of 2 of them will die from that heart attack. 1 out of 7 women will have breast cancer, and only 1 out of 29 of them will die of breast cancer. So everyone's worried about the wrong things. Heart attacks are the biggest killer of all women. And yet women don't get the education that that's your biggest risk. They're busy worrying about something that's not likely to happen to them and probably will not kill them. And the reason most women know more women with breast cancer than they do with heart attacks is because the women with the heart attacks die. You don't know them because they're dead. The women with breast cancer, the survival rates are almost 100% through stage 3. So it's like, of course, you know more women with breast cancer. They're the ones who are surviving. Okay, but the fear that has completely engulfed the whole world of menopause makes it so that women aren't getting correct information. They're getting terrorized with all the wrong things. They're using these sound bites of terror to govern their menopause choices. And it's like, there's nothing about fear here. This is as common as puberty. And the bottom line is, you just need to know that you can manage it any way you want, but you need to know what you're doing.
So a lot of women would like to know what they are looking for or how they will know when they start to transition at any age. What kinds of symptoms would give them a clue that it's time to wake up and get moving?
Anyone who has a child that went through puberty will tell you that the first time that child rolled their eyes, they knew, oh, wow, here it comes. And they knew that they were in for 3 to 5 years of hell. There was no need to get a lab test. There was no need to prove it. There was no need to shun the child or be shamed or be quiet about it. Everyone knew. It's just puberty. So menopause is identical to that. It's just that there are 22 symptoms of estrogen deficiency, and they are anxiety, palpitations, hot flashes, night sweats, insomnia, fatigue, irritability, mood swings, depression, dry skin, dry hair, dry eyes, dry mouth, dry vagina, pain with intercourse, urinary incontinence, urinary tract infections, weight gain, decreased sex drive, headaches. I mean, the list is huge. Here's the problem. These things don't hit you over the head all at once overnight. 2 to 10 years of a little bit of this, a little bit of that. This comes, this goes. Okay. But it's just like the kid rolling his eyes. The kid isn't a monster all the time. The kid is like on a roller coaster. They're up, they're down, they're okay. That's exactly what menopause is like. You're on a roller coaster for 2 to 10 years, and you don't put it all together because it doesn't all happen at once. So women waste years thinking they had something, but it went away, or now it's replaced by this. But everything's just getting worse and worse and worse all along, and they're not getting on the road to the diseases, and they're busy focusing on one symptom, which is hot flashes. That's the problem. And it's like, there are 22 things you should be looking for. And if you're having a few of them, that's your body talking to you saying, I don't have enough estrogen.
Well, women tend to compensate. So when they feel that something's not right, they sort of acknowledge it, but then they're like accommodated.
Exactly.
And so a few months later is, well, I guess it's not that serious. Oh, I guess I'm getting older.
Or
I'm stressed.
Or they compare themselves to their girlfriends. I get that all the time. They're like, well, I'm not that bad. My girlfriend, I'm like, it's not about anybody but you. You cannot do this by looking at other people. You have to focus on you. You have to be very selfish, and you have to realize no two women are alike, and your menopause will not be like your mother's or anybody. And the whole point is, you shouldn't care about anyone but you, but you got to know what to look for in order to even focus on yourself. And currently, women are not getting the information they need in order to focus on themselves.
Well, it's funny that you mentioned the eye-rolling teenager who started the period, because last week I had a patient come in and I said, where have you been? You haven't had your appointment. And one of her excuses was that my 10-year-old just started her period. And so I've been really, really stressed about this. And I'm thinking, okay, your 10-year-old started her period and her stress is affecting your life, tune of missing your medication. But it is, I guess it's traumatic for some, but mothers also put themselves behind the kids. The kids come first and everybody else comes first. And then one day they wake up and realize that they can't help anyone else if they don't help themselves.
It's just like when you're on an airplane and they say, put the oxygen mask self first and then assist others. I mean, it's the same principle. If you are suffocating yourself, you cannot help anybody. And if you're not taking care of yourself, you can't help anybody. And by the way, the woman with the 10-year-old kid who just started her period, guess what? Menopause is puberty in reverse. So this woman is going to go through menopause and she's going to be a geriatric teenager going through the same thing her kid is in the same household at the same time. Well, guess what that's going to do?
More stress.
Exactly. But see, if you know what's going on, you can alleviate everything for the geriatric teenager. Now, the puberty, the kid going through puberty, I mean, there's nothing you can do about it. It's going to happen. But puberty is when all these hormones come into your body, and menopause is when all these hormones exit your body. They're exactly the same thing at two different points in your life. So it would make perfect sense that they both take time. They're both completely common, but people talk about puberty and not menopause. And that's what's weird about it. It's like, why is one socially acceptable and the other one taboo? That just doesn't make sense.
Right. Let me ask you in the little time that we have left available about a phenomenon that I have noticed that I've not seen written anywhere. I don't know if there are papers on it, but I've noticed that women who are on hormones don't feel as much pain, for example, in their joints. So people who have really bad arthritis prior to starting the hormones, it's like almost crippling. And then they've been on hormones for a while and they're like, oh yeah, it's not that bad. It's much better. I don't have to go to the chiropractor as often and so on and so forth. My theory is because, as you said, deficiency of estrogen causes dryness of everything.
Exactly.
Dry eye.
Exactly.
I'm thinking that the joints are better lubricated when they're
Exactly. You are so right. Estrogen was like a great big oil can for your entire body, your skin, your hair, your eyes, your mouth, okay, your joints. And when you don't have enough estrogen, your joints become like a rusty door hinge. Okay, if you have a door hinge that rusts, it won't open and close. That hinge, it doesn't move against itself enough to open and close the door. And as the rust builds up, the harder it is to move that door. And if the door had a nervous system, it would be painful. That is exactly what is happening to your joints at menopause. And this is why so many women talk about joint pain, joint stiffness. It's all because you don't have enough estrogen to lubricate your joints. There's a theme. Everything dries up.
Right.
So everything about menopause is a theme.
The eye, the mouth.
Exactly. And the vagina. I mean, all this stuff, it's all one thing. You don't have enough estrogen to lubricate any of these parts of your body, and they're all drying up. And that's why there's so many different symptoms, and why women will say, well, I have this and I have that. Well, it's like, we're not robots. We're not all going to have the same things, but you have to know what is possible. And see, these women with joint pain are running off to the wrong kinds of doctors. They're running off to rheumatologists. They're running off, and the doctors don't know about menopause.
And they're getting stuffed with a bunch of medication
That's
not really helping.
They are. You're
Immune suppressives and all kinds of things.
You can't do estrogen's job with something other than estrogen. I'm sorry. You are not going to solve a problem that is due to estrogen deficiency with a pain medicine. Not going to work. And it's just like an insulin-dependent diabetic is not going to solve any of their diabetes problems with anything except insulin.
Right. And that rusty door is not going to stop being rusty if you just put water on it.
Exactly.
You got to put the oil.
The big thing I do in my consultations and in my education is I want you to know all your options for managing every aspect of your menopause, but I want you to realize that they do not all do the same thing. So the key to success is to know what each option can do and what each option cannot do. If your goal is to prevent the diseases, you need to know that the only way you're going to do that is the real thing. Okay, but the whole point is, if you understand this from the start and you understand that the very first thing you should do is decide on your goals, begin with the end in mind. Know that you have to decide what you're trying to accomplish first. Then you can just choose among the options that are capable of accomplishing your goals. But if you just start off with hit and miss and you're just taking care of symptoms, you're going to miss the big picture. And
Right.
this is the way in which most people go about this. And it's sad because tick, 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 all the while, you're getting on the road to the diseases, not realizing that you're going to be doomed.
And treating symptoms really is just a band-aid.
And it's
Putting
easier.
a band-aid on the symptoms, it's not treating the
It's
cut.
not. But and it's also easier to treat symptoms than it is to prevent a disease. You may get rid of all your symptoms, but you may not be preventing bone loss. You know, I always say your body talks to you in 3 different ways about your body's estrogen needs. And first of all, the only opinion that matters with regard to what you need is your own body's. Nobody else's opinion matters. Okay. So here's how your body talks to you. The problem here is that humans are not very good at listening to their own bodies. They're busy listening to all the other humans out here, but they don't listen to their
Breaking
own body.
news.
Well, but nobody knows what you need. Okay. So here's how your body talks to you. Number one, if your body has enough estrogen, you will have 0 symptoms of estrogen deficiency. That's just plain old common sense. Okay. Number 2, if your body has enough estrogen, your cardiac lipids will be stable year after year after year because you will not be getting on the road to the heart attack. So if you get your lipid labs every year and that they're worsening and worsening, worsening, your body's telling you it doesn't have enough estrogen. It's not about your diet. It's not about your exercise. It's that you don't have enough estrogen. And women fail to see that that's the problem. They say all the time to me, I don't understand it. Nothing's changed with my diet or exercise, but my cholesterol keeps getting worse and worse and worse. And I'm like, well, that's your body's way of saying you don't have enough estrogen. And then the third way your body talks to you is through your bone. And if you have enough estrogen, you don't lose any bone. But if you don't have enough estrogen, you lose tons of bone. So your body does a fantastic job of telling you everything you need to know. You don't need to listen to anybody else. Your body's not going to lie to you. But the problem is people don't listen to their own bodies. They're busy listening to this person and that person and switching gears and just shooting in the dark when in fact, it's not difficult to get any of this right. It's all very straightforward. You will nail it. You'll know you nailed it. You just have to listen to your own body.
Right. Well, today we've unpacked menopause as a major life transition from its biological roots to its far-reaching effects on our overall health. Dr. Taylor's expertise reminds us that knowledge is power, and being informed allows us to approach menopause not with fear, but with confidence and clarity. Whether it's managing symptoms, exploring treatment options, or simply understanding what's happening in our bodies, the key is to advocate for ourselves and seek the support that we deserve.
You got it.
As you can see, Dr. Taylor is very animated and very much in tune with menopause. Thank you for sharing your invaluable insights with us. And to our listeners, I hope this episode inspires you to embrace the stage of your life with curiosity and empowerment, but no fear.
Right.
Thank you so much for joining me. It was
Thank
really
you.
nice to see you again.
You
And I'm sure people will be checking your YouTube channel for your amazing information. And I love the Play-Doh, by the way.
Oh, I make all these crazy props. People are visual, and when you envision this stuff, it helps you really grasp the essence of it. And so, yeah, I make all kinds of crazy props, and I have a great fun time with it.
And it's really educating for people they can relate to seeing what you're talking about versus all the fancy scientific terms. And, people like to be able to see exactly what you're talking about. But thank you so much for joining me.
Oh,
It was
thank
really
you
nice to
so
see
much
you.
for asking me. I so appreciate it.
Maybe we'll do it again next year.
Okay. Thank you. Bye-bye, my dear.
Bye now.
Bye.
Thank you for joining me on this episode of Wellness and Wisdom. I want to remind you about my book, Sex, Sanity, and Sleep. It's a guide to thriving with menopause, covering everything from navigating relationships to reclaiming your health and happiness. If you're ready to take charge of this stage of your life and feel empowered, head over to Amazon or Ex Libris or my own website, drtuakli.com, and grab a copy. It's never too late to invest in yourself. Until next time, take care and stay informed.